Hi, everybody. Today I want to talk about a topic that can be very difficult to talk about. It's called hyperhidrosis. It's basically underarm sweat. Um, Underarm sweating and odor can be an embarrassing situation for many people. Primary hyperhidrosis is the technical name for the word, and it's defined as excessive sweating with no known cause. It can affect the underarms, the palms of the hands, the soles of the feet, and even the face. Overall, in general, sweating is a natural, important process that regulates body temperature. We all know that. So, in order for us to live and survive, we need to be able to sweat. However, in some cases, the sweating is excessive, and there's no real cause for it. And in those situations, we call that primary hyperhidrosis. And that can really cause patients a lot of problems with respect to physical and emotional effects. A lot of people don't like talking about it. There's feelings associated with the condition, including embarrassment, shame, helplessness, and this affects a lot of people. About 4.8% of the United States population is affected with primary hyperhidrosis, and that's a significant amount. That equates to about over 15 million people that currently suffer from this situation. But only about half of these patients have discussed treatment options with their healthcare professional. Contributing to this embarrassing condition is the fact that there's a social stigma in popular culture associated with sweat. There's a perception that people who sweat do not care about their personal hygiene, and as we all know, that's not the case. This also leads to more of personal embarrassment associated with the condition. Sometimes this makes it difficult to talk with their own doctors about the situation. Patients most commonly affected are those between the ages of 18 and 39. They have the highest prevalence, but also patients in their teenage years also have a high prevalence. So it starts at a young age. The reason many people don't talk about it is because they go silent for about 10 years, and some people are dealing with this condition and internalizing it for about 10 years before they even talk about it with other people. So again, a real source of embarrassment. There's a few questions that if you answer yes to any one of these is probably a sign that you may have primary hyperhidrosis, and I'll get to the treatment in a second. But if you answer yes to any one of these questions, there's a possibility that you have primary hyperhidrosis. So there's about 8 questions that I'm going to ask right now, and if you answer yes to any one of these, then you may want to talk about treatment to help improve the symptoms associated with it and the social stigmata associated with it. So here goes. The first, do you think or worry about excessive sweating every day? Number 2, do you change your clothes multiple times a day? Number 3, does excessive sweating in public cause you distress? 4, how many minutes or hours per day do you spend, quote unquote, dealing with sweat? Number 5, how many antiperspirants, powders, or deodorants have you tried to control sweating? Number 6, do you ever change your social plans secondary to the concern of excessive sweating or fear of excessive sweating? Number 7, does excessive sweating affect your work performance or career choices? Number 8, when you're in a situation involving contact with other people, or when you think about such a situation, do you experience sweating? In other words, does that make it anxiety provoking and therefore you sweat? So if you answered yes to any one of those 8 questions, then there's a possibility that you may have primary hyperhidrosis, and there is a treatment for it. So I'm going to get to that right now. There are 2 main treatments for primary hyperhidrosis. One is a neurotoxin such as Botox or Dysport. The nice thing about it is that it's painless and there's no downtime associated with it. The downside is that you need repeated injections lifelong in order to keep the sweating under control. Typically, Botox in the armpits and in the hands and even the palms and soles of the feet lasts about 3 to 6 months. Some people, it lasts about 6 months. So as you can imagine, you need to do these treatments at least twice a year, and you have to do it for the rest of your life. The good news is that it's very, very effective for sweating and odor, but as I mentioned, you have to continue with it. The second option is a really nice option, which we have in our office. It's called Miradry. It is an FDA-cleared device. Again, just like Botox, it's painless and there's no downtime associated with it. It takes about an hour, 45 minutes to an hour to do in the office. And most patients require 1 to 2 treatments to reach their final goals in terms of the amount of sweating. The nice thing about Miradry is, as opposed to Botox, it is a permanent solution. So after 1 to 2 treatments, whatever sweating reduction that you get is a permanent reduction. In other words, you do not need any more treatments. Again, the differences between the two is that with Botox, you have to do it sort of lifelong. With Miradry, 1 to 2 treatments and you're done. Now, one of the issues is that the long-term cost associated with Miradry is less than with Botox for obvious reasons, because we talked about, Miradry is a permanent solution. Some patients report never having to use deodorant ever again. I've done this procedure on one of my own staff members, and she says she's never had to use deodorant afterwards. I wouldn't necessarily say that that's the common thing, but it's one of the things that you can definitely experience, is never having to use deodorants ever again. Also, there's a significant cost savings associated with Miradry compared to Botox, because you can save significantly on dry cleaning bills, and also significant cost savings on constantly having to change your wardrobe. And finally, the improvement in self-esteem is priceless. So if you guys have any questions about Miradry or anything like that, you can call our office, and I don't mind sitting down and talking to you more in detail about it. Again, it's painless. There's no downtime to it. And I'm actually about to have my procedure done sometime this week, so I'll tell you how that goes. As always, thanks for tuning in. Appreciate you seeing this video. If you or anybody that you know has problems with this debilitating disease, please share it, and like me on Instagram, or like me on Facebook, and follow our Instagram pages to get more information about Miradry. So as always, thanks for tuning in. I know it's been a while since I've done my last video, but I promise more videos are to come. So thanks for tuning in, and I'll look forward to the next video.